In theory, could one utilize the controlled adverse environment chamber for both phase 3 pivotal trials to support registration in dry eye? I think you said yes.
Yep.
And and I don't know, George, if you have any comments you want to make about that model, so you're kind of a
Sure.
keeper of it? Or?
Yeah. Well, I think there's been quite a bit of discussion today about variability with endpoints and selecting the right patient and having patients that have consistent signs and symptoms. And really the technology that we worked on developing for the controlled adverse environment was to help us pre-select patients and make sure that they had modifiable signs as well as symptoms. And to make sure that that finding occurred not only at what's called the confirmatory baseline visit or eligibility, but also at the confirmatory. So really making sure that you've got a consistent symptomatic patient who has a consistent sign that you're evaluating. And really by doing this, we think that this helps with minimizing the standard deviations that's seen with the endpoints and ultimately having a better, well-controlled study for dry eye.
Yeah, I would just add that I agree with that. I think that Auro's contributions in terms of standardizing some of the variables that define dry eye probably set them apart from some other organizations. And I think one of the clear utilities that the dry eye chamber may well have is in terms of narrowing down the risks or the variability in the patient set that you choose for the study that you go into. So I think that George has hit upon the right point there.
And I think an interesting point to remember that Dr. Chambers made during his talk is that you could potentially, if I understood it correctly, use 2 different patient populations for signs and symptoms. You just need 2 studies for each one. Is that
right? The goal is to show replication of whatever sign or whatever symptom you show. That can end up being in 2 trials. It can end up being in 4 trials if you separate the particular populations.